So yesterday we spoke about chronic pain syndrome, which go check out that video. I'll link it right here in case you haven't seen it. But chronic fatigue syndrome is different, right? This is important because that means you can actually stack chronic fatigue syndrome with a chronic pain syndrome for this reason. Chronic pain syndrome we talked about, this is a mental rating. Well, chronic fatigue syndrome is not a mental rating at all. Many veterans assume that it's a mental condition. It's actually not. It's a whole separate rating, which means that yes, if you are rated for PTSD, for somatic symptom disorder, insomnia, any other mental condition, you can add chronic fatigue syndrome into that mix and significantly boost your overall rating and ultimately your pay. So for those of you who have chronic fatigue syndrome, you know that it's more than just being tired, feeling tired all the time. And yes, even after a well night's rest, you can feel exhausted. Just walking up to go get the mail can be, a massive event for you. And these things can last, 6 months, it can last years. You can get headaches, dizziness, mental symptoms from it. Just completely, your life is never the same. You really are, in the true sense of the word, fatigued, almost seemingly for no reason at all, even when previously maybe you had been athletic and been well. So it really is a big deal in terms of getting that diagnosed because it's a life-changing condition. Subsequently though, the rating for it is quite substantial. So let's head over to 38 CFR to see what the difference is between the ratings and how a lot of veterans actually qualify for the 100% rating threshold. Shortly after we check those out, I'm going to talk to you about the two-way street that is chronic fatigue syndrome and mental conditions, how one can cause the other and vice versa. So let's jump in. The criteria for a 100% VA rating for chronic fatigue syndrome is as follows: debilitating fatigue, cognitive impairments such as the inability to concentrate, forgetfulness, confusion, or a combination of other signs and symptoms. And here's the 100% threshold, which are nearly constant and so severe as to restrict routine daily activities almost completely, and which may occasionally preclude self-care. So let's speak on that for just a moment. So they're saying almost constant and so severe that it occasionally forces you to skip self-care. A couple of things that are self-care, the obvious is showering, brushing your teeth, things like this. But it just could be your daily chores, the things you need to do to take care of yourself. If this is affecting you to where you're so fatigued that, again, even getting up to use the washroom, things like this are difficult, are challenges now, then this could be you. And notice how it says nearly constant. Of course, that is a bit subjective, but if this is a massive part of your life where every day you're dealing with this, it's probably safe to say that your symptoms are nearly constant. So, and that's it. That's the rating for, the 100% rating threshold. That's not for a lot of veterans, a huge bar to overcome. This is the reality for a lot of you who are suffering from this chronic fatigue syndrome. I know loads of Gulf War vets in particular are suffering from this, and in a minute we're going to go how the PACT Act can help you get service connected. But let's first take a look at the 60% rating threshold. And here you can see 60%, these are nearly constant and restrict routine daily activities to less than 50% of the pre-illness level, or, so that's or, not and, or which wax and wane, resulting in periods of incapacitation of at least 6 weeks total duration per year. Incapacitation meaning you're basically lying down, right? You're out of commission, totaling 6 weeks per year. So that doesn't have to be 6 weeks at one time. That's going to be the 60% rating threshold. And then the ratings go down from there. So you can see how this could really apply to loads of vets, maybe yourself included. So what do you need? You need a diagnosis, first of all, for chronic fatigue syndrome. That's important. That has to be first. Secondly, you need a way to service connect it. So before I dive into how to get secondaries off of it, let's focus on how to win this claim first, which is especially if you're a Gulf War veteran or if you had toxic exposure during your time. Chronic fatigue syndrome, burn pits, if you're burn pits exposed in Afghanistan, Iraq, things like this. Chronic fatigue syndrome is actually outlined and listed underneath the PACT Act as far as what they consider their presumptive service-connected claims. So it could be as simple as knowing that you were in this certain area, that you were exposed to this certain toxin, and filing that claim as a PACT Act claim, and you can get granted service connection almost essentially automatically. It's very simple for those PACT Act conditions. If you're not a PACT Act qualifying veteran, you might need a nexus letter to really reinforce that service connection. However, again, if you can tie things together as far as your personal statement, hey, your DD-214 says that you were in this theater at this time, and that corresponds with this toxic exposure, you could be ready to rock and roll right away. Now, I want to talk about how you can even get more of a rating. Let's say you got 60% for chronic fatigue syndrome, and this even gives you mental symptoms, because of course, you really can't have life-altering chronic fatigue syndrome and just have it completely not affect you mentally at all, right? They go hand in hand. That is why chronic fatigue syndrome and mental conditions are almost tied together. Here's what I mean. There are a lot of instances where severe depression, severe anxiety disorder has actually been a catalyst for making people chronically fatigued and maybe even leading to chronic fatigue syndrome. People have won that rating, and also having chronic fatigue syndrome lead to depression, lead to anxiety, lead to somatic symptom disorder. So it is very worth exploring, talking to your doctor if you have one of those, to see if you have the other condition, because that could be a very clear nexus. That one would require a nexus letter, but again, you're talking about two massive high-value conditions being linked together, so you can stack them and possibly hit 100% with very few conditions claimed, because it is one of the easier conditions to get service connected. Fellow vets, I hope this helped you out today. Make sure you hit the like button, share this with someone who needs it, and I'll see you in the next one. Cheers.